A non-governmental organization is calling for urgent intervention in maternal health care. At a press conference in Lagos, concerned voices from across the health sector came together to confront the rising number of maternal mortality. Gloria Remo has the story.
Nigeria remains one of the countries with the highest maternal mortality rate in the world, recording about 1,047 deaths per 100,000 live births. Behind these statistics are faces and grieving families whose lives are forever altered by what should be a moment of joy.
Currently, the problem of maternal mortality in Nigeria is at a critical state. The latest data from the World Health Organization shows that 75,000 women died from pregnancy-related causes in 2023. This is really alarming. And if you compare that statistics with other countries like India, which is 7 times bigger than Nigeria, it tells you that it's a critical problem and something needs to be done.
In Lagos State alone, where the maternal mortality rate stands at 555 per 100,000 live births, the Maternal and Reproductive Health Collective took action. In 2023, they launched the Mama-Based Initiative, an effort to bring quality maternal care directly to undeserved communities.
The program utilizes a 5-step framework to tackle the problem, which is mapping, which involves identifying the communities that are most in need for this intervention, and so this involves using community health workers who live within these communities to identify vulnerable pregnant women in need.
Although adequate health care can reduce maternal deaths, poor health-seeking behavior persists among pregnant women due to poverty, cultural beliefs, and limited education.
There was low awareness about health insurance coverage, and most especially the one by the government, the NGO health insurance scheme. And then as a result of that, a lot of women face out-of-pocket expenses that deter them from seeking care.
Everyone has a role to play in reducing the maternal mortality. The women have to ensure that they access care, they access skilled health care at a facility that has a skilled birth attendant to take their delivery.
Now, with early results from the Mama-Based project showing real impact, stakeholders say it is time to think bigger. They're calling for partnerships that can expand such interventions to the most vulnerable parts of Nigeria, because no woman should lose her life giving birth. Gloria Remo, TVC News, Lagos.
Next on TVC News at 1 is Business News with Theophilus Elama. Over to you, Theo.
Thank you very much, Abosede. Let's